Hello, and welcome to our first Resource and Wellness webinar of the year. Humana and the American Diabetes Association have partnered to bring live, interactive webcasts throughout Illinois. On today's webinar, our experts will discuss best practices in managing diabetes. My name is Dr. Daniel Corboy, and I am the Chief Medical Officer for the Humana Illinois Medicare-Medicaid Alignment Initiative, also known as MMAI for short. MMAI is a health plan program for people who are eligible for both Medicare and Medicaid and is available statewide in Illinois. It is a voluntary program that allows those eligible to receive all their healthcare services through one managed care health plan. We strive to be present in the community to break down barriers in communication between members, community groups, provider groups, and managed care organizations to best serve our members. Thank you for joining us, and I hope you enjoy today's presentation.
Hello, and thank you for joining us today. My name is Rebecca Johnson, and I'm the Corporate Development Officer here at the ADA, serving the Illinois and Wisconsin market. I am pleased to introduce our moderator and panelist today. Taylor Mothing is a licensed clinical social worker and the first dedicated diabetes social worker for the Kobler Diabetes Center at the University of Chicago Medicine. Her role has become the patient navigator to help patients and their families be able to utilize all the support and resources needed to manage diabetes. This includes transportation, school, child welfare, food security, and more. Taylor works closely with the endocrinologist as well as other allied professionals like diabetes educators, pharmacists, health and wellness, community health workers that collaborate in a holistic approach for the benefit of the patient. Our panelist today is Elizabeth Murphy. Elizabeth is a registered dietitian and certified diabetes care and education specialist at Kobler Diabetes Center at University of Chicago. She has her Master's of Science in Health Communication at Northwestern University. She works with Taylor to ensure their patients can get the care that they deserve. So thank you both for joining us, and I will let you kick off our discussion today.
Awesome. Thank you for those intros. So Elizabeth, we kind of said before in our intros that we work together pretty closely in the Kobler Diabetes Center. So I guess we'll just kind of start off with what kind of is the care that we take care of when a patient comes to the appointment. So the first question would be, we can just kind of get started. First question is, what is the key thing a person with diabetes should know before they go into their first appointment?
So the first thing that a patient would want to know before they come to the doctor, and some of these sound like basic things, but things that are important to think about, like what pharmacy they want their medication to go to, certain insurance plans, contract with certain pharmacies. So it's good to just know that information up front. Know if that is going to be the doctor that you're going to be following up with about your diabetes care, or if that person is in network. Hopefully they would be if you have an appointment with them, but knowing that plan, like this is going to be my doctor, this is going to be who I will be seeing, and then asking what's the best way to contact that doctor in between visits, if there's a phone number for the clinic, or if they should sign up for my chart. Usually that would be a really good thing to also establish on your first appointment, especially if it's a new health system. You'll have to create a new account. And then always, not just diabetes, but having a list of whatever questions you want answered. I do that for myself all the time. Otherwise, the doctor's like, do you have any more questions? No, then you just forgot everything that you wanted to ask them. And before you leave, making sure you have your plan for follow-up, if it's going to be with that doctor, or if there's a nurse practitioner or someone who needs to see you in between appointments, or if they want you to follow up with a certified diabetes educator, knowing when you leave that visit what the next step's going to be.
Awesome. I think those are great things to have in mind when you go into that first appointment. So next question would be, what are best practices for managing blood sugars? Or I should say managing good level blood sugars.
So first thing I thought about is understanding expectations, because a lot of times patients don't even know what the blood sugar targets are. And so if your doctor says, check your blood sugars once a day or whatever it is, their advice is, you want to know, well, what time should I be doing that? What number should I be looking for? Because if you don't know that information, then checking it isn't as valuable as it could be if you had a baseline understanding of what the expectation is. And also knowing, like, what would I do in an urgent situation? What is a high blood sugar number? What do I need to be concerned about? Another big thing too, that I feel like I maybe see more of as a diabetes educator is what that medication is and how that medication works. Because a lot of times patients will, see the prescription, how it's written, when to take it, but they don't necessarily know what it does or why it's important to be taking it. And I think that can really help with managing blood sugar numbers as well, because if I don't know why I'm supposed to take this, then much less likely to be consistent with taking it. And there's just that like numeracy understanding, especially if we're talking about insulin too, knowing how to adjust things, if you should be adjusting things, if you're doing carb counting or fixed dose or mealtime estimation, knowing what that expectation is as well. How much and when to take those medications. And if there's titration involved if someone's starting on a GLP-1, you want them to walk out of that visit knowing that even though the prescription might be written a certain way, usually they try and write out the steps for you, but it's just good to know you don't want to take the full dose of that right away. And so that if you were to take the full dose of it right away, you might have a lot of unintended side effects. So really asking those clarifying questions with the provider so that you are able to do the best that you can with managing blood sugars. And don't get discouraged by blood sugar numbers. Use it as an opportunity to learn, like, why is it more elevated? Did I forget to take something this morning? Did I eat like a lot of extra sugar sweetened beverages or go to a birthday party yesterday? Instead of feeling bad or guilty about a number that's maybe a little bit higher than you want it to be, use it as a way to think like, well, what did I do differently? Why is this number higher than I want it to be? Or even low, if someone was to go low too. Obviously not in the moment, treat the low blood sugar, but afterwards think about, well, what happened that caused my blood sugar to go low? Did I take too much insulin? Did I eat less than I thought I was going to? Did I throw up? Am I sick? What's going on, to try and explain those blood sugar numbers. Yeah. It's long.
A lot, but that's great information. The part that I really liked about that you said was like the don't get discouraged by like the numbers per se. And I think that's specifically why endocrinologists give out ranges. So don't be like so set on those numbers. And I just feel like there's so much to manage with diabetes, clearly. And so not letting those little numbers kind of like bring you down and feel like, oh, I'm not doing enough, but taking those little wins when at least you're in the range, or like giving yourself grace for when you went to a birthday party and you had a piece of cake, like just taking it in stride. So I'm just really happy that we were able to speak on that part, because I feel like sometimes that gets kind of brushed under the carpet. So we just need to be mindful about it. So I appreciate you saying that.
Yeah, I didn't mention it, but I can't remember exactly who publishes it, but I think it's from Diatribe. It's called like 40 Things That Affect Your Blood Sugar Numbers. And I give that to patients sometimes because it's not just, your food and your medicine. Like there's so many other factors involved. And so that piece of not getting discouraged, there's no one way of knowing exactly what happened. And I think that can be helpful too, thinking about it in a bigger context than just this point in time. Yeah, we're human. We're gonna go to birthday parties and have sweet treats and stuff. And that doesn't mean you can't have those things. Just thinking about what can we do to help manage blood sugars if we know that's going to be occurring.
Yeah, and everyone's different. Tricks work for different people, and people eat different things. So I think it's definitely something kind of like to take, like, don't compare yourself to other people, and just take what you can and what works for you. And I think many doctors I would think that we worked with, and those we haven't, I think it's very common to just be very understanding about that. Speaking of food and what we are eating, speaking of birthday cake, what do I do if I don't know what to eat?
So most Medicare plans and most commercial insurance will cover someone with diabetes talking with a registered dietitian. I don't want to make a blanket statement because I know all insurances are different, but that is like a really good starting point if someone's diagnosed with diabetes, talking to a registered dietitian, because they'll be able to help talk you through different ways of looking at, if you need to do carbohydrate counting, or if your doctor tells you they want you to do the plate method, or if you're looking for new ideas or foods to incorporate. So I was originally a registered dietitian, and also it's National Nutrition Month, and today is Registered Dietitian Day. So if you have any registered dietitians in your clinics, wish them a happy day. Not to celebrate, but whatever, we can all celebrate our own field.
Sure.
And then if that's not an option, I hesitate to say the internet is a great place, but it can be. Always talking to people about, what's a more trustworthy website. But the American Diabetes Association has a really great website with lots of really good recipes specific to like diabetes. And then the American Heart Association also has a really good website. I mean, it's more specific to heart health, but you don't have to have diabetes or heart disease to eat a certain way. Everybody can eat this way. It's not like, oh, grandma has to do that because she has diabetes. No, we can all eat more fruits and vegetables. It's not because of a certain disease.
Yeah, I hear you. I mean, I guess I should eat more vegetables, but we will do that. And happy Registered Dietitian Day to you.
Thank you.
Speaking of vegetables, I'm just thinking like carrot. I definitely need more carrots, and I need to make sure I go to my eye appointment. It's common for people with diabetes to want to get their eyes and their feet checked regularly. So do they need someone to do that? Is that true? And then who could they go to?
So usually an endocrinologist would check someone's feet once a year, is usually happens. But if somebody needs to have more specific care for their feet, then they would be referred to go see a podiatrist, which we have a podiatrist in our endocrine clinic. I know that's not always the case everywhere else, but usually there's going to be a podiatrist who specializes in diabetes as well. So if your doctor doesn't check your feet, you can also ask them to, or remind them to, that you want them to check your feet once a year. And then for your eyes, also want to get your eyes checked once a year, which again, usually requires a referral to the eye doctor. And also at University of Chicago, we have an eye clinic in our building, which is really convenient. I know that's not the case everywhere, but if possible, it's great to try and keep all your care in one spot, because then it's just all in the same place. Just in terms of convenience, as like a patient myself, I would say it's easier to keep everything in the same place.
For sure. I feel like you can see, hopefully, as a patient, you can see that like providers are able to talk to each other more consistently.
Definitely. And
To wait, and like it takes a load off you not having to do it.
right. If it's all in one, and I know medical records are getting better and different places are able to communicate a little bit easier, but this wasn't even a question. But if possible, having all the care in one spot, so then your providers are able to just directly message each other if there is an issue that comes up, or if you do need to follow up on something with, like the eye doctor told you something that you want your endocrinologist to know, just asking them to forward your visit to them. And it just makes communication between everybody a lot easier.
Sure. So how would you, or how do you guide someone to manage their diabetes, or when it comes to managing their diabetes?
So we're thinking about like a team of supporters, right?
Yes. I would
Okay.
think, like us and like us as like the allied professionals and the doctor, like how can we work together to help manage a patient?
So if I guess it depends on your situation, because some people their diabetes is managed at a primary care clinic. But even if it is at a primary care clinic, usually there's going to be a nurse and an MA and people who are even social work or behavioral health, people associated with that clinic that you might not even know about. And so asking about who your support team is, and maybe not on the first visit, but because there might be a lot of overwhelming things happening at the first visit, but in subsequent visits, seeing who is a part of your care team, because it's definitely more than just the doctor. And we're very, very lucky in our clinic to have a lot of different support, which were mentioned in Taylor's introduction. But honestly, a lot of our patients don't know that that support exists unless the doctor specifically tells them about it. So as a patient, advocating for yourself and learning about what resources are available to you, what support is available to you, is a great way, even if you don't utilize that support, just knowing that you have those options. Even, I don't know why, I just thought of like diabetes camp. Even if our kids aren't going to diabetes camp, I still always tell them about it, because they just need to know there's other kids out there that have diabetes too. And just the
Oh no, it looks like we lost Elizabeth.
Oh
She's
no.
frozen.
Okay.
Um,
I'm afraid it was my
um,
internet.
Taylor, why don't you talk a little bit about your role in how you care for patients as a social worker?
Sure, yeah. So I, as a social worker, I am typically involved when it comes to patients who just need to have some extra support regarding maybe some barriers that are impacting their diabetes care. And that's who I work a lot with Elizabeth too, whether that's just simple as transportation to get to the appointments, or maybe I'm helping work with the educators and like what the diabetes school management is like, and like working with the school nurses. I work a lot with like complex family dynamics, whether that's involving child welfare or not. And then just kind of guiding them to more resources that are out there, especially in the Chicago community, specifically on the South Side, regarding food security, housing. Sometimes we do like helping them with get connected to like camp, and like lending closets, so all sorts of things. So if you guys, patients with diabetes, have questions about resources they have, Hopefully there's a social worker in your endocrinologist office, or even your PCP would have one too, your primary doctor. They would be good people to ask for resources and connections to all types of support that may not necessarily be specific to diabetes, but there are things out there to help all patients. I see we have Elizabeth back.
Sorry, I don't know where it cut off, but I was talking about support outside of the hospital too.
Yeah, which is great, because I just kind of talked a little bit about like community support while we were getting you back. And so I think we touched on how there's support outside of just the doctor's office to help with that. And that's where all of those professionals that we talked about, whether
Oh, she's back. Okay, carry on, ladies.
sorry.
Sorry, I don't know what's going on, but it should be fine. Even your family and friends too, as emotional support, or just support, telling people about, again, what you're comfortable with, but telling people about your CGM or your glucose monitoring, telling people about what medications you take, especially if you are insulin dependent, reviewing hypoglycemia, like what happens if you have a low blood sugar, if you have signs and symptoms of that, just what people should be looking for. And even like meals and activity, just what some goals that you have for yourself around those are. Again, what you feel comfortable with. Some people do broadcast to the world what everything is like with living with diabetes. Taylor and I follow a lot of people on Instagram that have type 1 diabetes and just like share with people all about that. I know people even post on TikTok, like changing their pump site, things like that. It really just depends on your comfort of how much you want to share, but even in your day-to-day life, just making sure that your family knows at least a little bit about what's going on.
Mm-hmm. Yeah, and it's always to what is you're comfortable with. There are people too that don't like to scream it from the roof about their diabetes, and that's okay too. Just doing what you're comfortable with, but it is important to have kind of a safety net of people who do know how to manage it in case of emergencies. So kind of leads to our next question is, why is it important to have a team of supporters and know who that team is, which we kind of talked about, but just kind of the importance of it. And I guess I'll kind of throw in my small social work thing too, that we didn't talk about, is like support is like, wearing like a medical bracelet.
Mm-hmm.
Also really helpful, because even if you don't want to share it to people, or you're with people who don't necessarily know, in case something happens, it's good to have some type of, whether it's a bracelet or a necklace or something you wear on your shoes, or you wear it on your watch, or it's just like set up in your phone, because a lot of EMTs are now trained to check your phone, because you can have a medical ID set up there, especially if an iPhone. Those are really good things to have to support you in case of emergencies.
Yeah, absolutely. And they can look very cute. I've told a few patients they get compliments on their bracelets.
Awesome.
So it's functional and fashionable.
Yeah.
But I was just going to add, it's 24/7. So having support, however that can be, whether if you're able to do a support group with other people who have diabetes, or even, like we said, following people on social media, or talking to your friends, or talking to your family about it. It doesn't have to be all encompassing all the time, but it's just good to have people who know what's going on and knowing what is helpful. Like, it's probably not helpful for someone to say, oh, you shouldn't be eating that. Not helpful. You can tell them that is not helpful. But say, like, it would be helpful if we, I don't know, went on a walk together after dinner, or if you checked in on me once a day to make sure I was able to take my medications, or whatever you think would be a helpful support.
Yeah, excellent points. Next question is, what should I do if I can't afford my medications for my diabetes?
This is a really big hot topic lately, especially with the insulin cap. But definitely talk to your doctor, let them know, because unfortunately, we don't know unless you tell us. The pharmacy doesn't usually tell the doctor, hey, this medication is too expensive for this patient. So definitely tell the doctor, hey, this medicine was too expensive, I couldn't pick it up. Also, a lot of the medications, especially if you have commercial insurance, on their website, they'll have cost savings cards. See if you need to switch your insurance, like if you are able to, if another plan would provide better coverage for your diabetes medications. And again, we're really lucky. We have 2 pharmacists in our clinic, so we work really closely with them. If your clinic has dedicated pharmacists, then talking to them too, they're able to really help figure out troubleshooting issues with affording medications, like if it needs to be switched to something else or if it needs a prior authorization. Unfortunately, it's not that easy to figure out troubleshooting, but if you make some noise and let people know that you're having trouble with it, usually clinics will have in place resources to tell you about or ways to get that covered. And if it won't get covered, then an alternative option that would be more affordable.
Yes. It looks like ADA also mentioned that if you go on diabetes.org, they also have other ways that help support patients too. So that's another resource that you can go to. Another question is, what if I have issues with finding transportation to my clinic appointments? Touched on that very briefly.
Oh yeah, because you said you help with transportation. So one of the things that was good about COVID, not many, but one of the things that was good is now a lot of clinics are able to do virtual appointments. And especially when it comes to diabetes and, being able to remotely monitor blood sugar numbers and insulin pumps and CGMs from the cloud from afar, it's a lot easier to do virtual visits. So if that's an option, talk with your provider and see. And also see if your insurance will help with covering transportation, and see if the hospital or the clinic itself will help with getting you transportation to your appointment. Would be different things to think about. I always tell my patients, I know things come up, but if transportation is why you can't make it to your appointment, that is something we can definitely figure out.
Definitely.
So I never want that to be the reason why someone doesn't make it.
Couldn't agree more. At least in the state of Illinois, all managed Medicaid plans have a transportation benefit. So if you have any type of Medicaid, whether it's, I don't know, Molina, Meridian,
Blue Cross,
County Care, Illinois Medicaid, all of those have transportation. So you can just call your insurance to get that benefit, and they have transportation for all medical appointments and behavioral health. So that's a cool resource that you can always reach out to. But then again, that's another one you could go to a social worker for. They can help you. Larger health systems have some type of like cap system kind of in place where they can hopefully, if like the insurance thing doesn't work out or whatever, you need like a one-time ride, they can maybe help you with transportation too. Not a guarantee. That's just kind of something unique to University of Chicago, but you can always at least ask. Question again, what should I do about diabetes burnout? That's a great question.
Yes, it's a hard, there's not really a very good answer, because there's a lot of different distress, I think, associated with diabetes. You could experience like physician related distress, just the fact of going to the doctor's appointments. And usually, at least in our peds and young adult, we want to see people every 3 months, which is pretty frequently, or even in adult or older adult, usually every 6 months, on top of whatever other doctor's visits that you have to have. So it can add up to be a lot of time to do those visits. Distress related to just the diabetes regimen, like having to check your blood sugar and take your medication, and keeping on top of those things, you just can't really stop thinking about what the next thing that you have to do related to diabetes. Again, everybody has different regimens and things, but those can all be related, like emotional burden and just related to, we were talking about your support system, or sometimes if you don't have a great support system, there could be interpersonal distress related to that too.
And
And
think, oh, sorry, go on.
Oh, you're good. And then definitely, if you are having issues with those things, reaching out to behavioral medicine or psychology, psychiatry, like talking to your doctor, letting them know that you're having those issues and seeing what resources you can be connected with. Because again, there's definitely resources out there. It's just a matter of making that follow-up and being able to have that extra support.
Yeah, that's awesome. Can you provide like specific examples of like what burnout would look like?
Not wanting to check your blood sugar, not wanting to take your insulin, not wanting to come to the doctor's appointment, not making a follow-up doctor's appointment. Yeah, could keep going, but it's not the most positive train of thought.
I mean, just basically being tired of having diabetes, which is a valid thought, but you got to make sure that it doesn't impact the care that you have to do to make sure that you can have a long, fulfilling life. And that's where I think a lot of clinics and diabetes clinics are picking up this trend of having to have a lot of more of these like additional supportive services in addition, because this burnout can really take a toll on a patient, and we don't want that to happen. But we also want to validate and recognize that it can happen, and that if it does, it should be kind of normalized, because it's just like, you guys, patients with diabetes have so much to manage on top of normal life existence. And so it's important to have that support in and outside the office of the doctor.
Yeah, absolutely. And I think as providers too, like you said, normalizing that, talking about that, because I think it's a pretty taboo subject, unfortunately, but we recently started doing like just a really brief depression screening when our patients are checking in. And that's helped too with identifying if somebody is having issues related to that. So then the patient, it's not on the onus of the patient to bring it up. It's like, well, we'll ask these questions, and if this triggers something, then we'll know what we need to do next. So it's just another way of thinking about how we talk about it too, making it part of the process.
Yeah, those are great points. Next question is, what should I ask my provider if I'm interested in learning more about diabetes technology?
So many people have asked me about the Super Bowl commercial about the Dexcom G7. Not trying to name drop anything. All continuous glucose monitors and insulin pumps, they're all really great tools for helping manage your diabetes, but it's just funny what people see on TV. So yeah, there is a lot of ways you can research diabetes technology even before you have your doctor's visit. The companies have extensive education resources on their websites, and also social media, different like Facebook groups, and parents of kids who have diabetes, or just people who have diabetes in general. Everybody likes talking about pros and cons of all the different diabetes technology. But if it's something you're interested in, for sure, talk to your doctor about it. Again, depends on your insurance coverage. But again, in Illinois, if you have multiple daily injections of insulin, usually you will qualify for continuous glucose monitor and insulin pump with Medicaid Illinois, and then Medicare as well. Little bit different rules, but usually if you're on multiple daily injections of insulin, you would qualify for a continuous glucose monitor. So that is just something to keep in mind too, but you don't know necessarily unless you try and unless you ask your provider. And I saw a question, is technology right for everyone? I think it could be. If even in my older adult population, we really try and provide the support and education that they need to successfully start on continuous glucose monitor. Maybe they don't need a smart insulin pen and maybe they don't need an insulin pump, but if they need to be checking their blood sugars frequently, I think it's really worth it to get on continuous glucose monitor, especially for just awareness about low blood sugars as well. I will say though, my older adults who have more success are usually a little bit more tech savvy, but you technically don't need to be. You do need to be able to enter in the serial number or open up the product to place it. So sometimes dexterity is important. But if you want to do it and you want to try it, it's definitely worth trying because you can always try it. And if it doesn't work out, that's fine too. You at least tried and you can go back to the way that you were doing things before. So it doesn't have to be this big, intimidating, scary thing. Like once I start on continuous glucose monitor, I have to always do this. You can go back to checking your blood sugar the old-fashioned way. But for the most part, I would say, yes, technology can be a great tool to help with managing diabetes.
Yeah, I think it's, at least from what I've seen, correct me if I'm wrong, Elizabeth, I think the goal is that it should be offered and available to everyone that wants to try it. And if you find that that works for you, then like, that's great. And if it doesn't, also great. It's about what manages your lifestyle and your diabetes. And so that's again kind of like what we talked about with like using that support and preventing burnout, is just kind of finding what works for you. And I think with technology and burnout, we've talked about, we've seen people who just want to take a break from their technology, and that is okay as well. And so similar for people who want to try something new, maybe try the new technology or not. Like, I think the goal is to make sure that it's available for someone to try it if they want, correct?
Yeah, absolutely. I mean, it's always that person's choice. We never force somebody to do something. I'm just now thinking of like all the things my patients have said they've had to do. Like one of my ladies had to use like a little gripper so that she could twist open the cap of her CGM, and had to use like a little stylus to press the buttons, but she made it work.
Yeah.
So it's definitely possible. It's just sometimes need that extra education and support. So, well, there's a plug for talking with a diabetes educator as well, if you are having issues with technology, to help with making it the best experience for you.
Yeah, and I think that all ties into like what to make sure you're prepared for at your appointment, is just if that's something you want to talk about, to bring that kind of question in and making sure you have that conversation with your endocrinologist and potentially your educator and your pharmacist, to make sure that that is like the right fit for you. And like, I feel like that's who's going to help you make those best decisions, and ultimately you as a patient yourself. Cool. So the questions, we've gotten a lot of questions since we started. So, Elizabeth, as a registered dietitian on Registered Dietitian Day, do you have any food recommendations like that are really good for someone with diabetes?
So I said earlier that like, this may be a cop-out answer, but really, definitely more vegetables, and everybody can eat more vegetables, not just people who have diabetes. There's vitamins and minerals and antioxidants and fiber, and they can help with your heart health. And there's really no downside to vegetables. They're a great addition to any meal or snack. I'm like the vegetable cheerleader, self-proclaimed. And usually they are pretty low in carbohydrates. Granted, like potatoes, corn, peas usually are more starchy, but that doesn't mean that you can't eat those things. It just means that that would count as your carbohydrate for that meal. And this is not just me saying this. The American Diabetes Association, the Academy of Nutrition and Dietetics, like, we can have sweet potatoes. We just want to make sure we know how much we're eating, how often we're having it, and what else we're having with it. So I think sometimes when we talk about nutrition and diabetes, it becomes a very restrictive mindset, like, oh, I can't eat that, I can't have that. And instead of thinking in terms of what I can't have, think in terms of what I could add instead. So vegetables is like number one thing that you could add instead. And yeah, diabetesfoodhub.org, which is through the American Diabetes Association. They have, I think I mentioned earlier, a lot of really good recipes too.
Yeah. Great points. I will try to eat more vegetables. Thank you. How does obesity come into play with diabetes? Can you talk more about like nutrition impacting that, like overall nutrition? No, vegetables are important. Got that.
Yeah, again, the American Diabetes Association has the Healthy Eating Plate, which is based off of like My Plate, which is the federal government. So we used to have the food guide pyramid, and now it's called My Plate or the plate method. So half of the plate is fruits and vegetables. A fourth of the plate is protein, which is like chicken, beef, pork, fish, eggs, nuts would all be protein foods. And then a quarter of the plate is carbohydrates, bread, rice, pasta, oatmeal, cereal, grits, farina. And we want to try and make, this is the US government's guidelines, try and make half of those grains whole grains, which means they'd have a little bit of extra fiber and a little bit extra antioxidants and fatty acids. And yeah, they're just better. And the way you can know if it's a whole grain is on the label. There's like the Whole Grain Council has a little stamp, it looks like, and it's just like a little wheat barrel, is a way of knowing if something's whole grain. Granted, I've seen like sugar sweetened cereal with a whole grain logo on it, so I don't know if that super counts in that whole grain serving, but that would be like what we'd want our plate to look like. And beverage of choice would be water or a beverage that's not sugar sweetened. So trying to limit the juice or soda, those kinds of things. The My Plate and the American Diabetes Association Healthy Eating Plate are a little bit different because for the diabetes plate, we want more vegetables than fruit, just because fruit does also have carbs in it. It doesn't mean that they completely removed it. It's still there. It's just a little bit of a smaller portion. So we can still have fruit, same benefits as vegetables, you know, vitamins and minerals, antioxidants, fiber, just it's going to be starchy. So that's why it's not as prominent as on My Plate. But they're basically very similar guidelines.
That all makes sense. Another factor that really comes into play while talking about nutrition is exercise. So what are the effects of exercise, and how do you know how much or what exercises to do?
So I did mention earlier, even like taking a walk after dinner can have an effect on your blood sugar numbers. Your body's able to more quickly absorb that food that it's digesting. And so it can help with bringing your blood sugar number down faster after eating. And so that could be one example of why it's important. I mean, exercise is important for a lot of different reasons, heart health being, I feel like, the number one that we go to, but it does affect your blood sugar levels too, and can bring them down a little bit more than if you were to just sit after eating a meal.
Awesome. Do you want to talk a little bit about like the diabetes risk? I know American Diabetes Association has a link, diabetesrisktest.org, but do you have anything else you want to add to that specifically?
I I am pretty sure that's like a 10 question long thing. You put in like your male or female, your age, your weight, your activity level, any other risk factors, and it tells you if you're at risk of like prediabetes or diabetes, and what to talk, if you probably should talk to your doctor, like based on whatever result that it gives you too. And yes, it's 60 seconds. It does not take that much time. I think I've done it. It's really quick.
Awesome. Good to know. Somebody asked, what can I do if I don't get enough blood to test for my blood sugar numbers? Any tricks?
I do have some tricks. Interestingly, I don't know that they're totally evidence-based. These are more anecdotal, because I think actually they could cause a discrepancy in the blood sugar numbers, but this is what I tell my patients. So, but like massaging your finger a little bit to try and just bring the blood up a little bit more. Again, more anecdotal. That is not research based, or even just like warming up your hands too before you test, just to give a little bit more blood flow in that area. And there is something called alternate site testing. Usually you need like another piece to put on top of the lancet, but you could test in another spot beside your fingers too. If that's really not working, definitely talk to your educator or your provider about it. Last thing is, maybe the lancing device isn't that great. Like maybe it needs to go deeper for you. Maybe the setting needs to be higher. Not all lancing devices are created equally. So that could be another option too, if you think it's just not penetrating the skin far enough.
Yeah. Trick too is you want to try to make sure you hit like the sides of your fingers, not like the top, because then you'll also likely not hit the nerves or anything. So just, I know like the ring finger and the middle finger and the pointer finger, technically the ring finger and the middle finger are good ones because the pointer finger you use a lot. But just those are things that I've heard too. Yes, sorry. ADA also confirmed that that test you talked about, that's super quick. It is 60 seconds long, so it's super easy. And then somebody else also asked, I think we can just kind of reiterate a little bit more, maybe go in depth, who knows, about like how to know which technology is right for you.
I guess like starting with, do you want to wear something on your body? And if the answer is yes, then you could consider using a continuous glucose monitor or even an insulin pump if that's something that you talk about with your provider and they say that could be a good option for you. And then once you know about that, there's even different types of both of those products. So again, seeing what your insurance covers, seeing what your doctor recommends, asking too if you want to see what it would look like. And usually places will have like sample things as well, so you could actually try it. And if you really don't want to wear anything, but you like using your smart device and you take insulin, there's also newer like Bluetooth enabled insulin pen that talks to your phone, which is pretty cool. You don't have to wear anything. It's just a different way of administering the insulin. So it's got like a calculator in the phone, so you can know how much insulin to take. And meter, a blood sugar meter, glucometer, usually has Bluetooth with it now too, because they're newer, and that can connect to your phone as well. So even if it seems like it's more simple technology, like a glucometer versus continuous glucose monitor, they still have there's an app. There's an app for that. Like there's an app for everything. Even like a way of tracking what food you've eaten. There's an app for that too, if that's important to you. So that would still fall under the realm of diabetes technology, even if it's not something that you're wearing.
Mm-hmm. The MyChart has an app too.
Yes.
Be able to talk to your provider. So we talked a bit before about kind of like the healthcare team as a whole, specifically obviously at Kohler, because that's where we work. But what are other healthcare issues that a patient should be aware of? I know there's heart disease, kidney care, eye care, foot care. risk for amputations, and like what are things that patients should be aware of to make sure that those long-term effects kind of stay at bay?
So two things that I thought of kind of briefly. One is you don't necessarily feel the complications of diabetes. Like you don't feel neuropathy right away. You don't feel your eyes like having trouble right away because it's happening in really tiny vessels of your body. You don't necessarily feel what high blood sugars are doing to your body until you do. And then when you do, it's a little bit too late to reverse those complications. So I think that makes it it's harder because, like, if you have a broken arm, you know that you have a broken arm. But if you have diabetic retinopathy, you don't necessarily know. You can once it's gotten to be at a point that it impacts your eyesight, but when it's first starting to develop, you don't necessarily feel that happening. So that's just why it's really, really, really important to do those preventative care visits. It's so, so, so important because there's no way of knowing unless you get those visits. Same with like kidney health. And I don't want anyone to be on dialysis, but you need to get those annual labs to check and make sure that your kidneys are still protected and safe. And so preventative care is like the best thing to do to try and get ahead of those issues. Is that I don't know. Do you want me to talk more about that, or is that okay?
No, I think that was good. I think that was well said. The preventative care was the big buzzword that I was excited about. So that was great. Someone submitted kind of a more personal question. They said, my friends and family aren't as supportive of my diabetes as I would like. How can I best explain my diagnosis and explain how they can support me? It's a great question.
That's a great question. I don't know all the family dynamics.
Yeah.
But say, like, I don't know. No, nobody's to blame in this situation. I didn't do anything wrong. There's not a certain way of doing something or a certain way of eating that caused this to happen. I have this disease. These are the things that I need you to know. And like, I find that it's helpful if XYZ. I find that it is not helpful if, like I said earlier, oh, you shouldn't eat that, you have diabetes. That's not helpful. Or excluding me from going out for dinner because I need to know how to count my carbohydrates and this restaurant isn't able to accommodate that. Like, let me make that decision. I don't need you to be including or excluding me based on my diagnosis.
Yeah, very well said. So it sounds like I statements. So that way it's very much just saying like, this is how I feel. This is what I want to have help in, or I don't want to have help in. I think it's important that when we're talking about support, that also setting up those boundaries are just as important. Sometimes there's people that may not be super helpful, and those are just people that we have to set boundaries with, that we don't need to talk to them.
Yeah.
And sometimes that's unfortunate, but then that just gives you opportunity to find people that will be helpful in the way that you need it, because everyone needs it in different ways, different capacities. And so it's important to find different people that can provide that for you, because this is a lot, and the more support you have, the better you'll be.
And don't have that conversation happen in the heat of the moment of someone being not supportive. Try and, like, I don't know, sit down with people, just having a casual general conversation about it. So the stakes are not as high.
Yes. Some examples of where you can find supportive people, which would be obviously within your personal friends and family group, within your clinic. You can use those resources. I know we at Kovler, we have a youth and parent group. So children and their parents and caregivers can join that group and talk about the trials and tribulations of diabetes. Elizabeth and I are also doing a young adult support group. And then there's camp, that where you can go meet other people, other kids can go meet other kids with diabetes. And I'm sure maybe ADA has other resources. That's what I know in Illinois. There could be potentially more that I just don't know about. But I think starting within your personal circle and then kind of branching out to support groups in the state would be super helpful. And whether that's in person or virtual, hopefully more things will be in person, but there's definitely stuff, there's groups out there. There's looking at those, there's podcasts, Facebook groups, the Instagram influencers to get representation are all super helpful too to see. And so looking at in social media as well.
Yeah, and there's even like dietitians and endocrinologists and healthcare providers on social media platforms too. Again, I'm hesitant to recommend the internet as like a blanket statement, but do some research, and if it seems like they're credentialed or they actually have diabetes and they're saying helpful things that resonate with you, then could be another place for support.
Yeah. So I feel like that's kind of brought us to the end. We got all the questions answered. But this has been super fun. Thank you to American Diabetes Association for inviting us to talk about this. And so it'll be a super fun. I think there's more coming to do that, some more expos. But we'll let ADA talk about that. But it was great here having you, Elizabeth. Thanks for answering all these questions. You did such a great job.
Thank you.
Yes, thank you both, Taylor and Elizabeth. I really appreciate it. And on behalf of the ADA, I'd like to thank Humana for making this program possible. And I did see a question come in. Will the ADA have an expo this year? And we are in the process of planning our State of Diabetes event, which will be held in November, which is American Diabetes Month. We will have an expo component to our event, so please stay tuned for more information about that. And again, I'd like just to say diabetes.org has some amazing resources that you can find, the risk tests, food hub recipes, insulin help if you need it. And if you're interested in learning more about Taylor and Elizabeth's support group or any other information that they have through the Kobler Diabetes Center, please reach out to myself. I'm Rebecca Johnson with the ADA, and thank you for joining us today, and hope everybody has a wonderful afternoon.